Okay. Myself, Dr. Sadhan Biswas, MD Medicine. Today, actually, my topic of discussion is the management of cholesterol. So, before going to discuss in detail, first of all, I like to thank the team of CIPLA for arranging this kinds of platforms from where we can educate the common people regarding some common health problems, which is not so symptomatic all the time, but that could be a harbinger of certain life-threatening conditions like any kind of cerebrovascular accident, any heart attack, any kind of other coronary vascular diseases, etc. Like, for example, the hypertension, the dyslipidemia, the impaired blood glucose in the form of impaired fasting glucose or impaired glucose tolerance. These kinds of issues actually doesn't present with certain specific symptoms or emergency conditions, but these things actually uh, precipitate the life-threatening conditions like CVN, heart attack, etc. So we should concern about this common health problem. so, for example, the dyslipidemia. So dyslipidemia actually the lipid imbalance in our body. So lipid, mainly the lipid excess actually. So this can also precipitate some kinds of heart disorders, this kind of cerebrovascular accidents, etc. So if we concern these kinds of problems so early and we can detect this early, then we can, if by detecting early, if we treat these conditions early, then we can manage, we can halt the life-threatening condition to be occurred. So our focus today is actually this dyslipidemia. So today we have choose the topic of cholesterol management. So what is this cholesterol actually? The cholesterol actually is a certain component in our body which is required for our body tissue proper function. The almost all the cells and tissues of our body need cholesterol to be proper functioning. Uh, so this cholesterol actually required for certain hormonal production, some vitamin D production and bile acid production in our body, which is also this vitamin D actually helps in our strengthening our bone, and the bile acid also causes the digestion of our certain things, so fatty and some fat like products. And, so the cholesterol is so essential in our body, and so the thought actually we have in our mind that cholesterol is always something bad, but that is not. The cholesterol is our essential in our body, and it is bad when it is in excess actually in our blood. So how the cholesterol comes? The cholesterol actually comes. Cholesterol actually, our body actually produce cholesterol for their requirement, according to their requirement, and also we can acquire our cholesterol from diet. So that is called as the dietary cholesterol. So but the problem is the cholesterol is actually not soluble to the water. So, and our blood is actually a watery in nature. So due to for dissolving the cholesterol in our blood, we need something that is called as lipoprotein, and this lipoprotein actually dissolve the cholesterol in our blood, and so that the lipoprotein component is actually contains the lipid portion or the cholesterol portion in center, and in the periphery it is have a protein coating. So what are the types of this lipoprotein? There are mainly two types of lipoprotein is we are concerned about. That is LDL cholesterol and the HDL cholesterol. The LDL cholesterol actually the low density cholesterol, and it's called as the bad cholesterol because it actually carries the cholesterol to the from the blood to the tissue, and if this LDL cholesterol become excess in our blood, then certain kinds of heart disease, certain kinds of these cerebrovascular accidents, and other kinds of renovascular diseases can precipitate. And the LDL cholesterol, when become excess in our blood, then actually what happens? The LDL cholesterol actually getting excess in our blood, then the blood, it is actually accumulated in the internal layer of the blood vessel, which can cause, there is by the accumulation of the cholesterol in our blood vessels, the blood can be stuck in, the blood flow can be stuck actually. So this can causes a the accumulation of the blood there, and causes this kinds of major cerebrovascular accident and other heart disease can happen by the way. The next thing is about HDL cholesterol. HDL cholesterol is actually high density cholesterol that is known as good cholesterol. That actually this causes this actually carries the cholesterol from the tissues and other body cells from to the blood, and from the blood to the liver. By the way, they actually excrete the excess cholesterol from our body. So that is good cholesterol. There are some other forms of fats is also in our body, that is triglycerides, and that is also actually produced in our body, and some also came from the diet. So now come to the issue that how can we detect that our body gets higher amount of cholesterol? What are the symptoms? What are the signs? Actually, the problem is there is no such kinds of prominent signs and symptoms of excess cholesterol in our body. So we have to, if we have to detect the cholesterol, the higher levels of cholesterol in our body, so we have to concern about it, and we should check our blood for lipid profile. Actually, the test which shows the cholesterol levels in our body, that is actually lipid profile, and we should do it in a fasting state. Actually. So the next thing comes. So what if what are the parameters of this lipid profile actually? So the lipid profile parameters actually contains about the total cholesterol level, the LDL cholesterol level, the HDL cholesterol level, and the triglyceride level, and other some VLDL and etc. So mainly we're concerned about the total cholesterol, which should be less than 200, and the LDL cholesterol should be less than 100 milligram per dl, that is unit, and the triglyceride level should be less than 150 milligram per dl, and our HDL cholesterol should be more than 60 milligram per dl. So HDL cholesterol should be more, and the LDL cholesterol and other cholesterol should be less. So the next thing, after if we detect any kind of cholesterol derangement, so what should we can do? What are the treatment aspects that we can do for? So the treatment aspect can be divided in two parts actually. In a non-pharmacological treatment, and some of them are pharmacological treatment. Non-pharmacological treatment means actually without medication, without that consists of actually the lifestyle changes, the dietary changes, and other formats. So, and the treatment, other part of treatment is the pharmacological treatment that consists some kinds of some sorts of drugs. That is, I will talk later. So first, I would like to talk about the what are the non-pharmacological aspects. So the non-pharmacological treatment we can do. So first of all, the lifestyle changes and the dietary changes. The dietary changes, the diet actually is very much important because the dietary cholesterol is some. If we take some foods which is contains the excess cholesterol, excess type of bad cholesterol, that causes the increased amount of cholesterol in our blood, because we already the bodies produce the amount of cholesterol they need. So if we taking the more cholesterol in our diet, that could be harmful for our body, obviously. So what are the foods should we avoid, and what are the foods should we intake more, or should we promote? So the foods actually we should avoid, that is consist of high levels of cholesterol, high levels of trans fat, high levels of and these kinds of fatty acids, etc. So the foods actually we avoid the cheese, the fatty meat, the tropical oils. This should we avoid, and we also can promote the food intake like the low fat cheese, the low fat milk, yogurt, and also some vegetables, fruits, etc. should be promoted. And also we should promote the components which contain more fiber actually, like the nuts, the the vegetables which contain the more fiber, and we also have to promote the more intake of vegetable oil, and also some kinds of beans, etc. So these kinds of foods we should promote for the patient. So the next thing comes the what about what else about the from the dietary habits. So the next thing comes is actually the exercise, the physical exercise. Physical exercise, in the part of physical exercise, mainly we have to promote the patient about a moderate exercise, aerobic exercise, 150 minutes per week. That is enough for a patient. And that could be, the example might be a brisk walking, the cycling, the swimming, etc. is enough. So the next thing is come the adequate amount of sleep. That's very crucial. In we have in the nowadays we all many of the people used to take the lots of stress. So we have to reduce our stress, and the chronic stress should be reduced, and we need some enough sleep. That approx 7 to 9 hours per day, that would be enough. So the stress reduction and also the increment or of its increment of the sleep, or maybe take an adequate amount of sleep. That is very important for our cholesterol management. And the next thing would become along this the pharmacological treatment would be, if this kind of non-pharmacological treatment is not adequate, then we should go for the pharmacological treatment. The pharmacological treatment options, there are lots of different kinds of drugs that could be helpful for us. So among this, the most commonly used drug is statin. The statins is actually reduces the LDL cholesterol levels mainly. And the next thing come is the bile acid sequestrant. It also reduces the LDL cholesterol level, but it is used less. And the next thing come is nicotinic acid. Nicotinic acid actually is at a less role on the LDL cholesterol level, but it actually affects mainly the lower the triglyceride level and increases the amount of HDL cholesterol. And next thing comes about the fibric acid or fenofibrate. That is actually, again, it is like the nicotinic acid. It actually mainly reduce the triglyceride level and raise the HDL cholesterol. It has a less effect on the LDL cholesterol. And the last is cholesterol absorption inhibitor, and it is also reduces the LDL cholesterol level. So, so if we want to summarize the total thing, so that would become in the modern era, in our now that at the present time actually, there is the era of actually non-communicable diseases. Non-communicable diseases means like the uncontrolled hypertension, the uncontrolled diabetes, the coronary artery disease. These are the nowadays the communicable diseases become less and the non-communicable diseases become more. So we have to very much concerned about the what are the harbingers, what are the modifiable risk factors of these kinds of life-threatening disorders, and and that is that is this kinds of dyslipidemia, hypertension, and this kinds of impaired fasting glucose or impaired glucose tolerance. That could be a harbinger for the disease, these kinds of modifiable risk factors. Among these, the dyslipidemia or the abnormal or the abnormal amount or mainly the excess amount of cholesterol is a very much crucial risk factor of these kinds of life-threatening disorders. So we always should concern about this, and as these are not so much symptomatic, so we need to check up of our blood lipid profile at a certain interval, so that we can detect this earlier and we can halt the progression of these kinds of life-threatening disease. So I think that's all for today. Thank you.